I think most of the staff, it was a fairly surreal comedy, so not entirely in touch with reality, but they'd all be broadly supportive of this cause, which is why we thought we'd have a little reunion and meet up here today and support the doctors.
And do you feel that the government are entirely in touch with reality?
They have some very laudable aims of a 24-hour health service, but that costs a lot of money, and I think the problem here is about the gradual devaluing of the NHS as a whole, rather than just even the junior doctors and their pay.
So here's the interesting thing. Certainly I know actor friends in things, they tend to get fan mail from the public who think that they really are a policeman, or whatever, in your case, a doctor. So do you think you've ever ended up sort of getting that adoration from the public?
Never had that adoration, but when we filmed it and we were dropped off in silver Mercedes to do our acting here, we did occasionally get mistaken for real doctors, and they did used to wonder why junior doctors were turning up in big posh cars. So we're here to correct that mistake.
How much of reality did you get to see when you were filming here at Northwick Park in northwest London of what medicine's really like versus comedy?
We saw quite a lot, because we spent long hours standing around doing nothing, the polar opposite of what the real doctors have to do. So we got a very interesting insight into how a hospital works day by day, and also at the other hospital where we filmed all the surgery in Basingstoke. So we can see some of the elements of the hours and the pressure they're under.
So very lastly then, what would your appeal be to the government, who say that these guys today are, to use their words, irresponsible and disproportionate? Do you feel they're irresponsible or disproportionate?
No, what's disproportionate is, what's important is to look at the NHS as a whole and how it's going forward, and not to devalue the notion of the profession as a whole, and to see that if you want a 24-hour NHS, this is going to cost an enormous amount of money. It's not just the doctors who will have to turn up through the night, but it's also the X-ray technicians, the administrative staff, and all these other people. So without that proper costing, then what you're going to end up doing is discouraging people from coming into the profession in the first place.
In Green Wing, I played Guy Secretan, the Swiss anaesthetist stroke love god.
Love god, and I suppose is that art imitating life, is it?
No, unfortunately, I'm not a love god, neither am I Swiss.
Can I ask you, obviously you're here today, you've got a huge amount of support from the junior doctors, but of course you're supporting them today.
Yeah, we're here to give our support to the junior doctors. We've looked on, I think, like the whole country in the last few weeks, and watched these negotiations crash and burn. And we're very disappointed at the way Jeremy Hunt has handled this situation. Anyone who has any dealings with the NHS will know that it runs largely on goodwill. The goodwill of doctors, the goodwill of nurses, to not leave patients behind, and to go above and beyond their contractual duties. But there comes a point when that goodwill becomes exhausted. And I just would like to urge Jeremy Hunt, as I think the whole country would, to get back round the table, negotiate with the junior doctors, and come to some sort of reasonable settlement. Nobody wants these strikes, let alone, least of all the junior doctors.
How personal do you think it is? Because Jeremy Hunt's a person. Do you think he's being bloody minded, or is he just doing his job?
My character in Green Wing was arrogant and could see little beyond his own personal agenda. So I have some insight into Jeremy Hunt.
But you don't think it's purely just a figurehead of the government? You think there is...
Well, this government, time and again, we've seen... I mean, look at the disability row recently, where Ian Duncan Smith himself resigned because he thought the government had gone too far. He said he felt that the government weren't paying too much attention to what disabled people thought because they weren't their core voters. So maybe that's the mistake the junior doctors have made. There are not enough of them to be statistically relevant in a general election.
But the NHS is hugely important to them. Do you think
They say the NHS is hugely important to them, but you have to fund it properly, otherwise it cannot run.
Okay then, so let's have a very direct message to Jeremy Hunt. Still look into the wonky eyes, ignore the camera. But your message to Jeremy Hunt, if you were standing here now, would be?
I'd ask Jeremy Hunt to get back round the negotiating table, talk to the doctors, listen to the concerns of the medical profession, and try and avert these strikes. He looks like being the first health secretary in history to cause an all-out strike amongst doctors. I'm not sure that's a legacy he wants.
I don't think there's much to laugh about in the NHS in general, and the fact that the show Green Wing took such a particularly bitter comedic slant at the business? Was it the only way of dealing with an institution that shouldn't exist? The NHS shouldn't. If you look at it shouldn't exist. And I think it's only through very sly or unexpected comedy that you can be surprised into understanding the reality of something like that. The point is, we didn't deal with patients. We didn't deal with the medical side of it. It was about the human side of it. I think that's what's interesting about today, is that it's the human beings that are the junior doctors who are standing up saying, we don't want to strike. We don't want to do this, but we have been forced into a position because of a lack of due process and conversation.
I mean, it is interesting as well. Perhaps it's a sign that I'm getting old, I don't know, but I think an awful lot of people, whoever they are, of whatever age, if they have an accident, they call 999, they go and see probably a junior doctor. Yet these men and women, they're really quite young men and women in many cases, making their way through life, looking after us. How well do you feel that we as a country, leave aside the government, are looking after them?
As you've said, it's an extraordinarily stressful position to be put into as a young adult, someone in their 20s who's making decisions not about typeface or cloth or timetables, but they're making life and death decisions. I think that's an enormous pressure to put on such young people. Yes, they are well supported by all the consultants. You can see the sort of pressure that they're now under. But I think we must treasure what they're prepared to offer, because they've trained for a minimum of 7 years. There's ongoing exams. It's extraordinarily difficult. I'm paid well for what I do. I didn't do that kind of training, and I think it's really important to treasure the NHS as a thing that is unique across the world, and make sure that we really value these young people who are willing to offer that kind of sacrifice to an institution that mustn't die.
Before we let you go, for Green Wing fans, I mean, you're here today, you're here to support. Do we sense another season coming on, another series?
Well, given that it was almost impossible to get 5 Green Wing actors together today for 1 hour, to get upwards of 20 Green Wing actors together for 9 months, which is what it takes to shoot a series, I think it's now an impossible. But as we know, in politics and life, it's the impossible that makes us work harder towards achieving something. So who knows?
Yeah, this is not a return of the Green Wing at all. We've all stayed sort of in contact, and it's great to see each other again. But Janice, one of the girls here, one of the junior doctors here, sent out, I think, a fairly sort of speculative email to see if we would be interested in coming to support, and it got through to us. And actually, we all agreed very quickly that it would be something that we would love to do. So it's a pleasure and an honour to be here supporting the junior doctors.
Well, I mean, it's one of those things, they genuinely love you being here. It would have been embarrassing if the guys from Casualty also turned up and they over-emailed.
Well, if the guys from Casualty turned up, there would have been an all-out fight between Green Wing and Casualty. It would have been an entirely different spectacle. Yeah, there would have been more than Holby City would have weighed in. It would have been like the end of Anchorman 2.
Well, they're all funny, just in different ways. I think I'm being... There we are. You're a patient as well. You played a doctor, you're a patient.
Yeah, well, hopefully not too regularly, but yeah.
But nevertheless, you want to know when you call 999 for a doctor, you're going to get one, right?
Yeah, 100%. I mean, I think that the junior doctors and doctors, the NHS, it's part of our social fabric, and these guys, they are young, intelligent, dedicated people. I don't think they're asking for the world. I think they know what they need. I mean, it's very telling that a junior doctor's training, a doctor in training, lasts longer than a parliamentary cycle, than an electoral cycle in itself. So I think it's time that Jeremy Hunt and the Department of Health really listen to what these guys feel they need. It's time for them to start listening and not just really sort of pretend to be listening and then get his big red pen out.
Well, they would argue that they do listen, and they put the blame on the BMA, and they say that they're not coming to the table and negotiating better pay on Saturday, if not the same conditions. To what degree do you feel that their portrayal of junior doctors behind you here as their actions being disproportionate and irresponsible, how fair is that?
Okay, so first of all, I'm an actor, okay? I muck about in other people's clothes, so I can only give you an opinion from that point of view. But my personal feeling, and from my knowledge of doctors and my knowledge and experience of the National Health Service, is that these guys are young, intelligent, dedicated people. They don't join this profession for riches, for gold. This is not like the 1950s when they were going to stuff doctors' mouths with gold to make this system work. These are dedicated young people, and they just deserve to be listened to, and they deserve to be taken seriously. I think this government I can't imagine how difficult it must be for a government to manage a country and to run an economy in difficult times. I can't even imagine the task laid down before the government. But I think that institutions like the NHS, and one might also argue the BBC, that are unique in the world, need special consideration, and they need to be thought about. You know, it needs to be done, it needs to be managed on a human level and a historical level and a social level, rather than just on that of a spreadsheet. I would be thrilled. I'd be thrilled to be involved. It's great to see these guys again. Greenwing's something I'm hugely proud to have been a part of. And yeah, I would absolutely love to be involved if there was another series. I have to say there's no plans to, but yeah, I'm thrilled to be a part of it, and I'd love to do it again.